Coming up on Mayo Clinic Q&A.
We cannot prevent aging. We can slow aging,
Right.
but we can prevent disease. That's certainly possible to do. And if you do a certain lifestyle, you can affect that.
Most of us want to live a long, healthy life, but how do we do that? Well, today on Mayo Clinic Q&A, we'll take a look at an evidence-based approach to preventing common diseases and maybe find some answers for living that longer, healthier life.
But the real answer is there is no just one thing. Because if you are exercising and eating great, but you're sleep deprived and super stressed, you just can't sustain the rest of your healthy habits. So you really need to take care of everything.
Welcome everyone to Mayo Clinic Q&A. I'm your host, Dr. Helena Gazelka. While we all know that our health affects our longevity and our quality of life, it's often very difficult to convince ourselves to do the little things that could help keep us healthy. There is a new book that might help us. It's called Living Younger Longer: 6 Steps to Prevent Heart Disease, Cancer, Alzheimer's, and More. Here to discuss is Mayo Clinic preventive cardiologist and the book's author, Dr. Stephen Kopecky. Welcome back to the program, Steve. Thanks for being here. And congratulations on your new book.
Thank you very much. It's a lot of fun.
Wonderful to have you here. And what a wonderful time of year for a book about our health, because oftentimes, even though we know it should be a year-long effort, we start thinking about this again as we start thinking about a new year and how we're going to face a new year. So perfect timing.
Right. We point out in the book that January 17th, you know, of course, what that date is. It's
No.
the date the average American breaks their New Year's resolution.
Oh my
Because
goodness.
we try to keep so much, we try to do so much at once and say, I'm going to change my diet completely. I'm going to change my exercise routine completely. And we last a little less than 3 weeks.
Okay, well, you'll have to tell us some techniques. Now, I understand that you had self-interest in mind when you wrote this book, that you're a cancer survivor, Steve.
Right. I had a cancer in medical school, and it was just kind of a bump in the road to me. But then 14 years later, I had a wife, 3 children, the youngest which was 2 years old, and premature death was not an option at that point. I wasn't even 40 yet. And so I figured I had to do something to change my chances of getting cancer, because my sister had just died of breast cancer. And so I really looked into it, and I was a treating cardiologist at the time, not a preventive cardiologist. So this was all new to me, but I looked into it and found that even though I had 2 cancers, the odds are I was going to die of heart disease, because that's the #1 killer for men, certainly. And then I realized that anything I would do to prevent heart disease would also prevent cancer. So it kind of went together very, very well. And I tried all sorts of things, you know, big changes that never lasted. So then I started looking into the science of changing, and it has to be tiny little habits. You know, there's a great quote from Dr. Charles Mayo, says it is unfortunate that people do not understand what small things diseases come. So it's tiny little things that get us. It's death by 1,000 cuts. And you can overcome that with just small steps over a lifetime.
Oh, that's amazing. That's wonderful. Thank you for sharing candidly your own story with us. And now in the book, you mentioned that, Steve, that there are things that we cannot change. We can't change our genetics. We can't change our age. We can't change our sex. What can we change?
Yeah, well, that's a very good question. You know, we cannot prevent aging. We can slow aging,
Right.
but we can prevent disease. I mean, that's certainly possible to do. And if you do a certain lifestyle, you can affect that. Now, you mentioned genes, and you know, if we have, say, a bad lifestyle or bad genes, if you have bad genes for heart problems, your risk goes up about 40%. If you have a bad lifestyle for heart problems, meaning you may not exercise, you may eat the wrong foods, you're not very active physically, you smoke or have diabetes, your risk goes up 400%.
Oh my goodness.
So the epigenetics is that the way we conduct our lifestyle affects how our genes manifest. And you can actually do that by doing things every day to prevent that from happening.
Wow, that's amazing. I didn't know, you know, we always seem to think the genetics predetermine us to have something, but not necessarily, I guess.
Yes, no, it's very true. And even breast cancer, from which my sister died, is, you know, very small percentage of that is genetic. Mainly it's lifestyle. And that's what many of the cancers and most of the heart disease, Alzheimer's, all these things come from. Certainly diabetes comes from a lifestyle. So the things we do and what we write about in the book is basically a compass. If you think of a north, south, east, and west. So north is nutrition, which is now the #1 risk factor for early death and disease in this country and this world. East is exercise. South is things like smoking and spirits or alcohol, but also the two forgotten risk factors, I call them, stress and sleep. And then west is weight, but weight isn't quite as important as people think. If you get into really good physical shape, your weight really doesn't matter that much, because when you get into good physical shape with activity and exercise, then you lose your abdominal fat or visceral fat, which is very pro-inflammatory and causes a lot of these diseases that we don't want, like cancer, heart disease, Alzheimer's.
So is that compass the habits that we should develop in life, Steve? Right.
The compass are the habits, the steps that we should develop in life. And, so many people come to me as a preventive cardiologist and say, doctor, I'm taking this supplement. I understand this supplement will really protect me. Or doctor, I'm eating this super food, this single food is going to protect me, right? Or I have this exercise machine or this exercise workout that's going to protect me from everything. And I say, it's not just one thing, it's a multitude of things that all fit together. So for instance, we give examples in the book, like if you are sleep deprived or stressed, and who isn't stressed these days? But if you get a vaccine, if we had a vaccine that we said was 20% more effective, we would say, I want that vaccine. But if you're sleep deprived or very stressed, your benefit from the vaccine is reduced 20% because your immune response just can't pick up and do the things it needs to do. So we really have to take care of ourselves. And the issue with our country, with our healthcare system, it really is designed to wait until we get disease and then treat the disease. So the prevention, unfortunately, is all on us. We need to prevent and take care of ourselves.
Steve, I think one of the hardest thing about making lasting change is making it last. You mentioned January 17th, that people often break their resolutions. What is the answer to incorporating long-lasting positive change in life?
Yeah, that's a great question. And, if you look at diets, the average American goes on a couple of diets a year and they last, 2 or 3 months, whatever. Our weight in our lifetime goes like this, we lose, we gain, we lose, we gain. So the answer, I think, is to make small, sustainable steps that you can live with. And when I say small steps, like for diet, I tell patients one bite of something healthy, meaning take off some processed meat off your plate or processed foods and put on something like a legume or a bean or a black bean or something. After a couple of years, that one bite difference will lower your risk of having a heart attack. So it's really small things that you can live with, and that's very important. Now, these holiday times are really tough because we all want to go back to grandma's or mother's or whatever and eat some of her great food. Well, I tell people, have that great food. Just don't eat that great, maybe unhealthy food every day. Have a little bit of it or have some while you're there. Put some other things on your plate that are healthy. So enjoy it, certainly. Don't deprive yourself, but just have just not every day. Have some smaller amounts. And when you can control what you eat, try to make things a little better. The fruits, the vegetables, the legumes, the fish, white meat, poultry. Have your main source of fat be olive oil, extra virgin olive oil, and a few nuts. These are things that you can eat and really enjoy them, but you got to work to find the things that you really like best, and everybody's a little different.
Steve, what does literature or data tell us about how long it takes someone to actually form a positive new habit? I'm thinking of myself. I get up at 4 a.m. every morning to exercise, but I can tell you that several years ago, that wasn't a very welcome task to me. And it took me some time to make that such a part of my routine that now I wouldn't even consider skipping it.
Yeah, that's a great point. Great question. The common thinking is it takes about 3 or 4 weeks. Okay. But that is really based on a plastic surgery study decades ago. That's how long it took people to get used to the changes from their plastic surgery. So really, the habit, the term break a bad habit is not a correct term. It's nothing could be more untrue. You never actually break a habit. You just replace it with another habit that you enjoy just as much, if not more, and is healthy. So for instance, when you started exercising in the morning, you didn't just one day say, oh, boom, I'm going to do this. It was like a process. First, you started getting up at that time of the morning. And then you started putting on your tennis shoes that time of the morning. And then you started to actually maybe sit on the bike or the treadmill, not just do anything, just stand there. And then it's a process. It's a little steps one at a time you can live with and sustain.
Yeah.
And the secret is when you do it, get some dopamine in your brain going, because that's what lays down the habit for memory. And that's the way you do that is to reward yourself. So I get up every morning also, and if I'm in the kitchen at 5 a.m., I'm making coffee. And sometimes, it's a habit, and a habit by definition is something you do while your brain can do something else. The brain loves habits because it doesn't have to spend energy on them. So I'll make the coffee, I'll drink it, and I look around, I think, who made this coffee? Is Linda, my wife, here? Nobody's in the kitchen but me, and I made the coffee, obviously. So, the habit is something that you just get into the process of doing. And if you can make it a healthy habit, that's the best part. And that's exactly what you've done, Helena.
That's wonderful. I love hearing about incremental change, because I do think it's true that people just take too much on at once. And so this is good news for us.
Yeah. If I wrote a book that said, here's how to make $1 million in a month, or here's how to raise a perfect child in a month, you'd say, this guy doesn't know what he's talking about. You can't do that in a month. You have to save a bit of money every week with your paycheck so you can retire. You need to always be there for your kids as they're growing up, so they can learn from you. And the same thing with our habits. We need to, in our healthy habits, we need just incrementally, slowly change them.
Steve, where can we find the book?
Well, of course, Mayo, it's a Mayo Press book, and Mayo has it. You can find it on just about every online, Amazon, Barnes and Noble, Target. I was talking to one of my friends the other day in Seattle. He said it's in 4 bookstores in Seattle. So really, it's all over. And but everything is bought online these days. So I encourage BAM or one of those Books A Million. All those have them.
And we will make certain that we have a link to it on our Mayo Clinic News Network site as well.
Yes, I appreciate that very much. It really is. It's very readable. I tell people it's a very scientific book, scientifically based, but it's easy to read. It's a classic Mayo Clinic, built for a patient to read and understand and get a take-home message from it.
Do you have any last words of wisdom for us today, Steve?
Well, yes. I usually get asked, what's the one thing? What's the one thing that we need to do? And the answer is, it's two-part answer. First is, if there's one thing that you're doing that's really way off the charts, like not good, like smoking, or say you're very, very sedentary, or say you're eating lots of unprocessed or ultra-processed foods every day, which is 57% of the calories we eat in this country, then change that. Try to change that a little bit at a time. But the real answer is there is no just one thing, because if you are exercising and eating great, but you're sleep deprived and super stressed, you just can't sustain the rest of your healthy habits. So you really need to take care of everything. And sleep, for instance, is one of those things that if we miss some sleep, we've missed it the rest of our life. Unlike calories, we can always make up the calories we miss for eating, but we can't get back the sleep. And the stress is something that we all have to deal with. We cannot, you can't say, okay, stress is going to go away. It never will if you have a job or a family or anything else, but you can kind of mitigate it or make it so it's not quite so bad and not quite so harmful to you.
Wonderful. Thank you for being here today, Steve.
Elena, thanks for having me. I appreciate it.
And we thank each of you for joining us today, too, to hear about Dr. Stephen Kopecky's new book, Living Younger Longer, 6 Steps to Prevent Heart Disease, Cancer, Alzheimer's, and More. I know I'm going to go pick up a coffee because I learned something new today. I hope that you did too. And we wish each of you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then, click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.